Ladies and gentlemen, the academic procession will enter shortly. You are kindly requested to stand.
Bomma le botate, molokoloko wa diruteri o tla tsena ka nako e kopana, le gopelwa go ema.
Dames en here, die akademiese prosessie sal binnekort inbeweeg. U word versoek om asseblief op te staan.
By the power vested in me, I hereby constitute this assembly as a legal congregation of the University of Pretoria. During this assembly, degrees and diplomas with all the associated rights and privileges will be conferred and awarded to the candidates whose names appear in the program. Please take your seats. Ladies and gentlemen, we request you to join us in silent prayer or meditation to give thanks for the achievements of our students. Thank you. Ladies and gentlemen, as Chancellor of the University of Pretoria, I extend a hearty word of welcome to you at this graduation ceremony. In particular, I extend a hearty word of welcome to the recipient of the Chancellor's Award, Professor C. Ishel Maiden, Deputy Director, Student Systems, Mr. D. Swanepoel, the Dean, Professor C. Dijahe, Deputy Dean, Health Stakeholder Relations, Professor F. Senkubuche, Deputy Dean, Teaching and Learning, Professor V. Steenkamp, Deputy Dean, Research and Postgraduate Studies, Professor Mashamba Thompson, Chairpersons of schools, heads of departments, directors, emeriti and honorary professors, and other lecturers and their spouses, representative of the Student Representative Council, who will present the SRC academic honorary colors, All persons to whom degrees and diplomas will be conferred and awarded to this afternoon, all spouses, parents and other parties, as well as dignitaries whom we may not be aware of. I now request the Dean to introduce to me the candidate for the presentation of the Chancellor's Medal.
Madam Chancellor, I have the honor to introduce to you Professor Carolus Bernardus IJsselmeiden for the presentation of the Chancellor's Medal. Professor IJsselmeiden is a public health physician, epidemiologist, and an academic and social entrepreneur with a long career in rural and urban health and healthcare in South Africa and promoting public health schools in Africa. He is the Executive Director of the Council of Health Research for Development, CORAD, in Geneva, Switzerland, and an adjunct professor at the University of KwaZulu-Natal. Professor IJsselmeiden graduated as MD from the Erasmus University in Rotterdam, the Netherlands, in 1980 and started working as a medical officer at the Elim Hospital in Limpopo until 1987. His interest in public health began with efforts to eliminate childhood malnutrition, vaccine preventable diseases, and blindness caused by trachoma and vitamin A deficiency. He obtained a diploma in tropical medicine and hygiene from Medunsa in 1983 and the diploma in public health from the University of Witwatersrand in 1984. In 1988, he completed the examination of the College of Public Health Medicine of the Colleges of Medicine of South Africa. He joined the Johannesburg City Council as Deputy Medical Officer of Health, and in 1991, he obtained his Master's in Public Health degree from the Johns Hopkins University School of Public Health in the USA. In 1995, he was appointed as professor and head of the Department of Community Health at the University of Pretoria. He became the founding director of the School of Health Systems and Public Health in May 1999. From 2000 to 2003, he was appointed by the Minister of Health to the National Health Research Ethics Committee and the Essential National Health Research Committee. In 2004, he started his current position as Executive Director of CORAD. Professor IJsselmeiden has over 150 publications in peer-reviewed journals. His current professional interest concerns the nature of research collaboration between high-income and low-income countries, how these can be made more fair and equitable, and how collaborations can be co-designed and managed to optimize research and innovation capabilities in low-income countries. Madam Chancellor, I request you to present the Chancellor's Medal to the candidate.
I hereby present the Chancellor's Medal to Professor Carolus Bernardus IJsselmeiden. I have the honor of requesting Professor Carolus Bernardus Ishel Maiden to address this assembly.
Chancellor Justice Kampepe, Dean of the Health Science Faculty, Dr. Christian Tian de Jager, many of the people who are here, please accept my understanding and appreciation of protocol, but I'm not going to spend the very few minutes I have doing protocol. So let me tell you a story. After saying, Chancellor, I expressed this beforehand, but I'm truly honored and greatly appreciative of this medal. It is an appreciation for work done, work that I did, but as I tried to emphasize that so many others did with me. So let me formally accept your, the medal, but not just for me, for all the staff of the School of Public Health, in top leadership, in staff positions, and people who are continuing the School of Public Health now. The reason, and here's where my story starts, why I'm so happy with this medal is that I have this cupboard at home and it had an empty spot for a medal. And this came very suited, so it fits there. And you may wonder why this happened. So let me tell you the story. You heard that I started medical practice as a GP in Elam Hospital, at that time in the northern Transvaal, 100 kilometers was the border with Zimbabwe. And we were a hospital of 550 beds, 200 outpatients a day, 9 clinics to be serviced, and we were 6 doctors. So work was just all over the place all the time. And in spite of that, we managed to produce articles. We had support from local universities and international universities. And by chance, the first article that I produced on beliefs and practices on measles in Gazankulu, which was that time called the homeland of Gazankulu, gained the prize. I got a medal from the best article by a GP in the South African Medical Journal for 1993. However, I declined the medal, and you may wonder why. So here is the background, and that leads to public health, and whether you're in dentistry or in health sciences in general or in public health, I think you'll appreciate what the issue is. So in 1982, a year before that article was written, there was a massive outbreak of poliomyelitis. And poliomyelitis in children is very painful, it is very distressing, and it has a high mortality rate. So we had the northern part of Gazankulu, we had the middle part, the Letaba area, where there was the outbreak, and we had the southern part, where I want to credit Professor Erik Boeg, who is here with me on stage, with which I'm very happy, where the two of us were trying to somehow, with 10,000 doses of vaccine that we had, to counter an epidemic of major proportions. My wife, who is also here, she was the physio in hospital where you have 280 patients lying on the floor of the church, of the chapel, because there were no beds, crying, feverish, in agony, because polio is really a bad disease if you survive. So we're 280 children who got the disease and were disabled, 40 children who died. In spite of all of this, we tried to get and understand. In the beginning, we tried to get vaccines and we couldn't get it. We couldn't get it from Johannesburg because Johannesburg said, well, if you have it in Gazankulu now, because of migrant labor, we will have it soon. So we are not giving you our vaccines, even though they were sitting on stocks. The National Institute for Virology didn't have enough stocks, was trying to produce, but it would take weeks, if not months. The white local authority at the time in Pietersburg, now Polokwane, wouldn't give vaccine because they said, we are the white authority, you are Gazankulu, so we can't share between those authorities. And even when they came to vaccinate children, or the children of the white so-called seconded officials in those homelands, we stopped the ambulance in their track. We demanded to have the vaccine that they hadn't used, and they refused because of this. And for me, this became such an overwhelming, if you want, professional and personal understanding of what politics and health have to do, that for me it changed my career from pediatrics or surgery or internal medicine to start focusing on public health and getting equity in health. Because you remember, if you have a pandemic, as COVID shows us, if you have a pandemic, doesn't matter if you are vaccinated, it matters to you. But if you want to stop the epidemic, we all need to be vaccinated. And they didn't understand that at the time at all. And of course, the political system didn't allow you to focus on it. So in public health, they often say, you need to focus on equity. So an epidemiologist, the first thing that they do is to ask questions. What are the inequities? How can we see between different groups who suffers more, who suffers less, who has more disease, who gets better quicker? Once you have described those inequities, you can then start finding out, say, what causes those inequities. And then public health takes over to intervene, to do something about those inequities. And at that time, we couldn't do anything about those inequities of vaccine because there was apartheid in the country. So when I was appointed in 1995 as head of the Department of Community Health at the University of Pretoria, where they had a lot of support for the idea of a school of public health, I came to a department that was 3 people. I was number 3. So we were minor in terms of the health sciences. Public health was really not well built out. And for me, it didn't do. For many in the university, it didn't do. And we started thinking about a school of public health that ultimately became the current School of Health Systems and Public Health, that has multiple areas, that stretches across departments, that deals with dentistry, but also with public service management, that deals with environmental health and other engineering, for example, for the disabilities that would be caused by polio. So in my speech in 1996, when I officially the inaugural lecture was titled Starting from Square Two. And I think you guess where that comes from. You know, we had left square one. We are now at square two in 1996. Democracy has arrived. We can now talk about equity and act on equity and start doing the work that public health professionals and others with a commitment to equality in health need to do. And it doesn't matter whether you do that as an individual clinician or whether you do that on a group of population health. And that is where the square two came from. And 2 years later, we had a School of Public Health. The first graduates of that school are on stage with me as well, and many of the colleagues who helped to start the School of Public Health going are on stage today. And so the University of Pretoria and the School of Health Systems and Public Health have really made a major impact. It's starting to grow beyond the borders of the continent. They get invited across everywhere that I see LinkedIn pictures, where I see meetings at Geneva at the WHO, and where I understand last month you had an honorary doctorate of the man who sits across the road from me and leading a slightly bigger organization than we do. So Dr. Ghebreyesus, the Director General of the WHO. So certainly I think Geneva is in Pretoria very present, and I'm very happy that that is the case. So 20 years after that, after the School of Public Health, I left it in hands of Professor Kuku Voyi, who couldn't make it today. Professor Nico Klaassen is here, Professor Paul Rader. There are a variety of people who came and took it over and brought it to where it is now. Professor Lekan Ayo Yusuf has taken over the current chair, is growing the field of a truly African leadership in public health on the continent, which I can only say it is great. And where we can help, where I would be interested, that would be fantastic. Having said this short story, I also thought about 1 or 2 messages for you as graduates, and of course for your parents and family and close ones who helped you get to this stage. First of all, thinking about that many in this country, even if they would have tried, they wouldn't be here today, even if they would have tried. So equity in health, whether you do it as an individual dentist or GP, or whether you do it as an epidemiologist, I think thinking about making sure that your contribution to health starts from square 3, as I call it. Start thinking about square 3. I wanted to say this originally. We have bad news and good news for you. The bad news is you are still at square 2, because I think the country didn't move all that quickly away from square 2. The good news is you are at square 2, because that means you're not at square one where I was when I started. So use the opportunity to help define what is next in health for all. What could this country do? What can you do as individuals to get us all to square three? The second advice, if I can call it that way, is be unreasonable. Now you might wonder what advice I'm giving to people. But I used to teach a lot by slides, and one of those slides says that all progress is due to unreasonable people. And what it means basically, if you want to change, and I understand now the hashtag life changers of the Faculty of Health Sciences is about change. And change is tough. I can tell you I lost many of my hairs trying to get the School of Public Health going. And if you want to change something, that takes time. So be unreasonable within reason. And the last part that I want to say is you never do it alone. One of the key roles of university education, one of the key roles that the university and the school can give you is a network of people that you can call on when you want to have change, when life is tough, when you need more people behind the wagon to get it pushing. That is when you need a network. And so I'm so happy that on an occasion like this, where we see over 400 people graduating just from a School of Public Health and the Faculty of Dentistry, keep in mind that this is the group of peers that you can count on to help you in the next stage. So as a last thing that I want to say is congratulations to the graduates, congratulations to the parents of the students who have worked very hard. Remember that even if others could have worked hard, they might not have made it to this stage. So think about square three, keep it in your mind, and let's all work over the next 10 years with the school, with the university, with you, of defining square three and help us get us to square three. With that, Chancellor, thank you very much for the medal. Thank you.
I offer my profound gratitude to Professor Ishel Maiden for the wonderful, inspiring speech he has presented us. Let's give him another big round of applause. I now request the Dean to introduce to me the candidates present whose names appear in the program.
Madam Chancellor, the supervisors will now introduce the doctoral candidates from the School of Health Systems and Public Health.
Madam Chancellor, I introduce to you Joy Blaise Busi Baruta, who has complied with the requirements for the degree, Doctor of Philosophy, with a thesis titled Women's Acceptability of Maternal Health Services between 2008 to 2009 and 2020 to 2021, and its impact on maternal mortality in a health sub-district of Johannesburg, South Africa. In this thesis, which was prepared under the supervision of Professor M.D. Peu, who is not present now, and with myself, Professor A. Musekiwa, and Dr. L.J. Bamford as co-supervisors. The candidate proposes a practical definition and conceptual framework of healthcare acceptability. The candidate describes the complexity of healthcare acceptability, drawing on existing literature and experts' opinion to build a consensual understanding of this concept. A practical measurement tool is developed to assess maternal healthcare acceptability applying factor analysis. A structural equation model shows a good fit with good reliability and validity. Hypothesis test confirms the relationship between components and their corresponding constructs. The findings suggest an inverse relationship between maternal healthcare acceptability indices and maternal mortality rates, thus creating a new opportunity for reducing maternal deaths in South Africa and other developing countries struggling to meet maternal mortality rates targets predicted in the Sustainable Development Goals. 6 journal papers are produced from this PhD study, and they offer wide-ranging practical implications of healthcare acceptability and equip health professionals to apply and assess this concept more confidently. Therefore, Madam Chancellor, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Madam Chancellor, I introduce to you Osios Dewa, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Disaster Risk Management Implementation in Malawi, Policy Options for Resilience to Adverse Impact of Flooding in Nsanje District. Prepared under my supervision and with Dr. Donald Makoka at Lilongwe University of Agriculture and Natural Sciences as co-supervisor. In this thesis, which is truly transdisciplinary, the candidate assessed the capacity for and implementation status of the World Health Organization's Disaster Risk Management Strategy for Health. Deliberative polling was tested as a means of consulting communities about flood risk management interventions they supported for community flood resilience. Findings suggest that the development of institutional policy and legislative framework integrating health approaches in disaster risk management in Malawi, while commendable, needed to be matched with community-level actions where public health and livelihood impacts of disasters are experienced. As community-supported flood risk management interventions focused on addressing their well-being ex ante and ex post disasters. Community risk management planning and implementation in Malawi should consider fair adaptation principles, particularly prioritizing public health and community engagement in fully operationalizing its well-developed disaster risk management framework. 3 papers have been published has provided scientific community with as a specific resilience framework. Madam Chancellor, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Madam Chancellor, I introduce to you Ruben Musarandega, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Analytic Study of Epidemiology of Maternal Mortality in Zimbabwe, prepared under the supervision of Professor R.C. Patterson and with Professor R. Machenkano at Stellenbosch University and Professor S. Mujanja of University of Zimbabwe as supervisors. In the thesis, the candidate looked at epidemiology of maternal mortality in Zimbabwe and the findings of 2 reproductive age mortality surveys that assess changes in maternal mortality ratio and causes of maternal death in Zimbabwe in 2007 to 2008 and 2018-2019 and were presented. The candidate reviewed, validated, and cleaned the 2007-2008 data and conducted the 2018-2019 survey. The 2 maternal mortality ratios were estimated by using survey statistics methods. The candidate calculated the MMR's annual average reduction rate and compared it with the projected annual average reduction rate calculated using WHO methods, thereby assessing the country's progress towards the SDG for maternal mortality. Changes in the causes of maternal mortality were analyzed using epidemiological and biostatistical methods. Furthermore, causes to prioritize in current maternal death interventions were identified. The candidate analyzed the incompleteness and misclassifications of death in the data sources and recommends ways to strengthen data quality in the information system. Madam Chancellor, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Madam Chancellor, I introduce to you Dr. Patrick Ngasa Piotti, who has complied with the requirements for the degree Doctorate of Philosophy with a thesis titled Optimizing Insulin Therapy for People with Uncontrolled Type 2 Diabetes in Primary Healthcare in the Tshwane District, Gauteng, South Africa, a translational multi-phase study, under my supervision and the co-supervision of Professor Webb from the School of Public Health. In his thesis, the promovendus aimed to optimize insulin initiation and titration for people with type 2 diabetes at primary care level in Tshwane. Using translational and implementation research, he conducted cross-sectional studies to inform the development of an intervention, followed by a feasibility study and a SWOT analysis to evaluate the intervention. Barriers to insulin therapy included insulin resistance, clinical inertia, and health system factors. A multidisciplinary team then subsequently developed an innovative intervention that comprised nurse-led insulin initiation and physician-directed titration enabled by telemedicine. Included was proactive patient follow-up with home visits by community healthcare workers. The findings of Dr. Piotti's work suggest that patients with type 2 diabetes can safely and effectively be initiated on insulin by primary healthcare workers. Madam Chancellor, I hereby request you to award the degree of philosophy on this candidate with all its associated rights and privileges.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Madam Chancellor, I introduce to you Walter Odoch, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Assessment of the Influence of Sustainable Development Goals Declaration on Health Financing Reforms for Universal Health Coverage in Uganda, a Stakeholder's Perspective. This thesis was prepared under the supervision of Prof. Charles Hongoro and myself, Professor Flavia Senkubuge, as the co-supervisor. In his thesis, the candidate sought to explore how the Sustainable Development Goals Declaration is influencing health financing reforms for universal health coverage in Uganda. The candidate used the case to develop a theory of change framework in order to analyze how such global declarations influence reforms in health financing systems at a national level. The theory of change that was developed combines the conceptual framework of health financing functions with policy transfer theory and health policy analysis framework. The theory of change developed is therefore appropriate for exploring complex issues such as the influence of global policy agenda on the national health financing reform process, where there are aspects of policy transfers from the global to national level. Madam Chancellor, I request to you to confer the degree on the candidate with all its rights and privileges.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Madam Chancellor, the following candidates have complied with all the requirements for the degree Master of Science in Epidemiology. Victoria Sikiti. Master of Science in Epidemiology, Epidemiology and Biostatistics, Sakile Tlamini. Fiona Els. Etna Malare. Manala Makua. Sinkubile Mafundla. Janita Mostert. Emelina Mutabizi Nizere. Machlodi Ratsio. Mahlaku Tebiloane. Zazi Zikalala. Yeah, Zazi. Master of Public Health, Aju Kanezu Aleke. Mati Bodiwa. Mona Lisa Chikati. Takunda Chirau with distinction. Karen Dupree. Sindile Kiva. Wisile Mabasu. Moepani Manamela with distinction. Well done. Nte Beleni Mashao. Zetembi Mfeka. Nomkosi Mokuna. Loratung Mopolekeng with distinction. Inge Kleinans. Zikona Mpayana. Lindelwa Mkubeni. Yeah. Pretty Nkomo. Zanile Nsikane. Tsiriletsu Piri. Onaletata Soni with distinction. Yeah? Ndukoza Zulu. Madam Chancellor, the following candidates have complied with all the requirements for the degree Bachelor of Science Honours in Biostatistics, Epidemiology and Biostatistics, Matilda de Freitas. Ayanda Fakuzi. Leratu Khatswetswe. Mapai Kolane. Danai Kwenda with distinction. Unkukeku Makukbele with distinction. Riksongile Malumane. Mokhadi Mapicha with distinction. Kimberly Maringa with distinction. Tsitsi Marurika. Makua Mataba. Donald Msashu. Matsediso Muhlala. Tulani Moyane. Matomi Mukhanyai. Beverly Musaka. Lavelesani Negondeni with distinction. Yeah. Mabulukoa Nsane. Wendy Sekhele with distinction. Mpo Seleka with distinction. Bachelor of Science Honours in Human Physiology, Occupational Hygiene, Mosamu Cholo. Matidiso Lekwahane. Yeah? Unkwako Molodin. Princess Mukai. Lebulisani Muravami. Yeah, yeah. Ngarendue Mutavatat Saindi. Lufuno Nelufulele. Lesego Raditla. Nsohaki Tsotsetsi. Glau Tuse. Madam Chancellor, the following candidates have complied with all the requirements for the postgraduate diploma in occupational medicine and health. Delarice Fassum. Amos Kubeka. Eve Lusenga. Nabayawi Musa Tayop with distinction. Tabiso Nsali. Tangala Mpila. Munyaratsi Mushunji. Situkuzile Mieni. Mukonduleli Nzaza. Maria Hunkopodi. Nkobile Sitole. Lucia Sondiasa. Carl Tabane. Monique Wohler. Madam Chancellor, The chair of the School of Health Systems and Public Health will introduce the candidates who complied with all the requirements for the diploma, postgraduate diploma in public health online.
Esther Abraham with distinction. Andrea Alexandra with distinction. John Alaka Penn with distinction. Teletso Aporelli with distinction. Bright Owosu Apia with distinction. Felicia Bajomo with Matevu Bajomo with distinction. Machwene Baloyi with distinction. Mahofe Baloyi with distinction. Olufunke Bankole with distinction. Someya Bedi with distinction. Loyiso Botia. Zamani Kele with distinction. Jane Trainer with distinction. Butumelo Chomani with distinction. Nkumisa Nkobe Yankees with distinction. Nonkululeko Dineka with distinction. Nokulunga Dladla with distinction. Sorry, Nompilo Dlamini with distinction. Patrick Dlamini with distinction. John Tulani Dube. Febana with Bernice Fernandez with distinction. Prudence Folosi. Yolande Furi with distinction. Kemesha Govender with distinction. Sise Gwadi with distinction. Tobile Gumede with distinction. Doreen Guanyuki with Doreen Guayuki. This way. Milibo Ambulembe with distinction. Farai Ov with distinction. Petsile Jackson. Clancla Jele with distinction. It's fine. Jereki Kapola. Ramasela Kelly with distinction. Lerato Koira with distinction. Sinazo Kumalo with distinction. Alenta Kwane with distinction. Pinky Kubeka with distinction. Makananelo Kumalo with distinction. Klengiwe Kunene with distinction. Bobby Ledwaba. Pauline Lefotola, with distinction. Ndantuleni Leroy, Poichoko Lekwe with distinction. Yakomotitswe Letwana with distinction. Motselisi Lipot. Akona Luliwe with distinction. Mongezi Lomo with distinction. Mpumezeni Luvono. Elizabeth Mabele with distinction. Immaculate Mabasa with distinction. Nondumiso Mabai with distinction. Cabello Mabeleng. Sakele Mabuza with distinction. Linda Madikazi with distinction. Madikani Madumo. Elias Maima with distinction. Rendani Maemo with distinction. Mpatisani Maepa with distinction. Nkaza Makata with distinction. Portia Mageza with distinction. Noncle Magubani with distinction. Wait. Wandile Magwaza. Sifesihle Majana with distinction. Tandikile Matlangu with distinction. Ophelia Maila with distinction. Raise Cha Maja. Mabato Majuda with distinction. Cordella Macabo with distinction. Claude Macalen with distinction. Krimitsetso Mahlaji. Emerensha Tepitso Margat with distinction. Muketwa in the Deni, Malindi, Guguleto Nowazi Malinga with distinction. Maria Mafep Maluleka with distinction. Suzukani Ashley Maluleka with distinction. Rito Malungani with distinction. Ponso Shelley Mamabolo with distinction. Tamadfulini Mamba with distinction. Mapolo Mapen with distinction. Indo Vasiani Mapila. Clara Masala with distinction. Lungile Maseko with distinction. Mambo Masevere with distinction. Intabiseng Mashap with distinction. Alina Mashani. Yvonne Masike with distinction. Nonkululeko Masilela with distinction. Nomfanelo Masiza with distinction. Maputi Masogo with distinction. Elizabeth Mosambuka with distinction. Ntombi Futi Maswangani with distinction. Dorcas Mataben. Kolosa Matanzima with distinction. Ashley Matauri with distinction. Dikeledi Matoko with distinction. Lebonken Machediso with distinction. Bolokwa Machiani with distinction. Demwa Matessen. Zamekile Mbata, distinction. Lungisani Mbokazi with distinction. Ipeleng Maleto with distinction. Yeah, this way. Mpepeseng Meyatso with distinction. Kalipile Ngavani with distinction. Andiswe Ngolombani with distinction. Pendulum Mambi with distinction. Mandisa Zandile Precious Matlanga with distinction. Zanele Mslanga with distinction. Tinitso Mtlongo with distinction. Nkumbeka Mtlongo with distinction. Nokwanda Mtlongo with distinction. Nombinin Kentani with distinction. Prudence Mkachwa with distinction. Mavis Mkwanazi. Nonkuleko Mklondo with distinction. Barbara Mnisi with distinction. Benzeni Mnisi with distinction. Selby Mnisi with distinction. Maibongwe Mkanta with distinction. Jacob Mofokeng with distinction. John Mofokeng with distinction. Maseromo with Mofokeng with distinction. Mabato Mogadime with distinction. Okarabo Moapi with distinction. Maneo Mohapi with distinction. Shwaru Moeta with distinction. Keketiswe Moamani with distinction. Margaret Moami Moabo. Leboha Molise with distinction. Take off your shoes. You can take off your shoes. Take your time. This on, it's important that she must cap. Refuel Moloise with distinction. Nevi Monari with distinction. Lerato Mosito with distinction. Makloti Mutsue with distinction. Give him Mutleng. Lerato Mutimele with distinction. Kutsofatso Matepelo Motlatledi Mandi Implakiani with distinction. Nombul Nombulumko Mpenzo with distinction. Zamukule Mpesane with distinction. Lisa Mpiti. Piwokule Msomi. Fuduzile Mtembo with distinction. Sipiwe Ntombeni with distinction. Maureen Mtumkulu. Luxon Mzimiri. Lianmo Mupakati with distinction. Mahota Muswubi with distinction. Nomzamo Mvandaba with distinction. Phineas Nari with distinction. Nzalama Ndukula. Sebastian Mporo. Siyanda Mporo with distinction. Tulani Ngidi with distinction. Tumisho Ngubela with distinction. Pumlan Ngakamba with distinction. Tubelihle Ngubani with distinction. Ndulamo Ngwenya with distinction. Tokozile Ngwenya. Glory Nklapo with distinction. Nokwanda Nkala. Fezeka Nkalanga. Roland Nkalende with distinction. Sikhanyiseswe Nkomo with distinction. Eleni Nkosi. Webo Nkosi with distinction. Sitabile Ntelezi. Nicholas Ntoni with distinction. Kenile Ntuli with distinction. Tsakani Nyambi. Elizabeth Nyantanda with distinction. Ujala Pandey. Matabile Dorothy Padla with distinction. Sekoputs Masumani with distinction. Tembeka Kwabe. Tande Karabuchak with distinction. Prabhashan Ragashviran with distinction. Lerato Ramatlala with distinction. Mapula Ramashia. Kutwano Ramatsepi with distinction. Sachin Ramayan with distinction. Fulufelo Rambao with distinction. Waketi Rametse with distinction. Latasha Ramlukan. Tamara Ramala with distinction. Mamoshibuti Ramoya with distinction. Chilizi Rachivaga. Margaret Ratloko with distinction. Nkensani Records with distinction. Dipur Rampisa. Sebolelo Sebulwani with distinction. Molatelo Seboni with distinction. Zimkona Sikho. Ellen Tendai Segula with distinction. Ipeleng Seundelo with distinction. Tebeli Sekwa with distinction. Mzuyanda Selano. Kamokelo Serach with distinction. Mokhareki Serete with distinction. Matlapani Sataka with distinction. Bernardine Shezi. Nalisiwe Sibaya with distinction. Sibia with distinction. Esther Siboza with distinction. Alicia Sikhota with distinction. Jabulani Simelani with distinction. Tobilage Simelani with distinction. Joseph Sitoli with distinction. honorary Shivutso with distinction. Ayana Solomani with distinction. Emily Stofile with distinction. Katlea Fotabete with distinction. Yolanda Tambiran with distinction. Timakato Tebe with distinction. Kepile Tokwa Taban with distinction. Mafedi Klati with distinction. Valentina Trivella with distinction. Anna Shabalala. Fiso Shabangu with distinction. Sahile Chazi with distinction. Nombuyeselo Tutswa. Louis van Rijn with distinction. Thabo van Wyk with distinction. Anthony Zulu. Kebetsile Zulu. Nompulelo Dlomu with distinction.
Madam Chancellor, the supervisor will now introduce the doctoral candidate from the School of Dentistry.
Madam Chancellor, I introduce to you Professor Martin Foster, who has complied with the requirements for the degree Doctor of Philosophy, with a thesis titled The Effects of Access Cavity Preparation, Canal Shaping, and Pericervical Dentine Preservation
on the fracture resistance of endodontically treated mandibular molars. Prepared under the supervision of Professor P.J. van der Vijver and Professor G. Mako as co-supervisor. In the thesis, the effect of different endodontic access cavity designs in combination with Wave 1 Gold and tronatomy instrumentation systems on pericervical dentin and ultimately fracture resistance in human first mandibular molars were evaluated. Minimum dentin thickness and volume were investigated pre and post endodontic treatment. The effect of different access cavity designs and preparation methods on preparation times was also evaluated. Finite element analysis models were created to investigate the effect of pericervical dentin preservation on the fracture resistance of first mandibular molars. The ultimate aim of preserving pericervical dentin in endodontically treated human teeth is to increase its longevity. The results of this study highlight the importance of pericervical dentin preservation and aim to give the dental practitioner insight into the management of this critical component. Madam Chancellor, I request you to confer the degree to the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Madam Chancellor, the following candidates have complied with all the requirements for the degree Master of Science in Dentistry. Michael Beckenstrater with distinction. Jacqueline Lowe. Anay van Aswegen. Master of Science in Dentistry, Maxillofacial and Oral Radiology, Stefanie Potgieter with distinction. Master of Dental Surgery, Periodontics and Oral Medicine, Liande Kotze. In Prosthodontics, Karimsha Naidu. Postgraduate Diploma in Dentistry, Endodontics, Fehada Abramji. Bhavesh Dulap. Cheryl Kotze with distinction. Emily Pridgen. Lene Rabi. Janus Smith. Chantal Vosloo Dekker. In oral surgery, Lianka Kutzer. Diane Naidu. In pedodontics, Debbie Ellen Johannes. Azra Khan. Nompumelelo Mbete. Tasha Radley with distinction. Nicolene Uys with distinction. In prosthodontics, Fatima Amuji with distinction. Vongani Makubele. Shuen Chai Young. Bachelor of Dental Surgery, Kelly Anthony. Kiash Arjun. Hayden Barnard. Marnel Bester. Mohammed Dasu. Ilam Dawood. Ms. Dawood. Bule Dlamini. Clara Dreyer. Misbah Isaac. Nadine Ferreira. Henning Fourie. Nikhil Goli. Larushan Govender. Terfa Guman. Muhammad Hassim. Evita Ivanov. Letitia Kandolo. Raisha Kazi. Rudolf Krier. Tamsin Mackenzie. Safia Mohammed. Mbasakazi Matanzima. Zina Matijowski. Musina Musa. Umi Musa with distinction. Lufunu Musengwa. Banashe Mutepa. Brunel Nadia. Anese Widendal with distinction. Shanae Olwager with distinction. Aisha Patel. Gemma Pelizon. Shanae Pick. Satsopa Ramogoyanan. Nafia Sidat. Evans Tanje Kamga. Motsibi Tibe. Nadia Uys. Angela Wang. Ilse Weppener. Pei Ching Wu. Awande Zuma. Bachelor of Oral Hygiene, Janae Appel, with distinction. Elnay Bueta. Melindy De Jager, with distinction. Megan Hendrikse, with distinction. Riatlegie Mangope. Bongani Ndo. Ufense Nisani. Talia Pereira. Ntsotsi Ralekuku. Sivukazi Skele. Well done, Chancellor, everyone.
Ladies and gentlemen, I think this is an opportune time to give our graduates a big hand for their hard work and perseverance. And I would now like to ask our graduates to applaud their families, friends, and spouses for their support over the years. We have now come to the end of the proceedings. Before we close, I wish to invite all present for refreshments afterwards in the marquee situated in front of the Rembrandt Hall. You are requested to stand for the singing of the national anthem and to remain standing until the assembly has been dissolved and the academic procession has left the auditorium. The words of the national anthem are printed on the inside back cover of the program. Please rise. Ladies and gentlemen, by the powers vested in me, I hereby dissolve this assembly of the University of Pretoria.
God,